Hello everyone, I'm Ellary T Nhizwa. Before I start my presentation, I would like to share a short incident that happens to me in 2013. I was hit by a bicycle and I had a minor cut on my kneecap. That time my mom used to apply this blackish liquid solution. And I remember crying a lot because it was very itchy and disturbing. So today I have finally realized that the solution was Betadine solution, which I am going to present on. So enough with stories, let me go into detail of what Betadine is. So Betadine, it is a topical antiseptic that has been used to treat and prevent skin infection. It has been used for over 50 years in hospitals and clinics around the world. It is very effective against a wide range of bacteria, fungi, and viruses, therefore making it an ideal choice for treating minor cuts, scrapes, burns, and other skin infection. So today I'll be discussing on the mechanism of action, pharmacology, route of administration, and how it is used in the radiology department. So here I have a picture of Betadine solution. We can actually see that it is a blackish liquid solution. So it can also be called Providone iodine. So in Betadine solution we have an active ingredient which is called Providone iodine, which we're going to talk about it later on the pharmacology side. Moving on to the mechanism of action, Providone acts as a carrier of iodine. So when released, the iodine penetrates the cell of microorganism and destroys the proteins and nucleic acid. It also inhibits vital bacterial cellular mechanism and structures and oxidizes fatty acids and amino acids in a bacterial cell membrane by interacting with the functional groups of fatty acids and amino acid. Additionally, the iodine disrupts the function of cysteine enzymes, causing them to be denatured. The interaction of iodine with this group that I've talked earlier, the fatty acids and amino acids, result in cell disintegration, loss of integrity, which leads to destruction of microbial protein and DNA strands, and finally kills the microbes. It also activates T lymphocytes, macrophages, and monocytes for healing. These cells are part of the immune system. Moving on to the pharmacology. Pharmacology refers to chemical makeup and behavior of a drug. So here I'll be talking about the pharmacology of Betadine. I have talked earlier that the active ingredient of Betadine is Providone iodine, which is a chemical complex of polyvinyl pyrrolidine and elemental iodine. Betadine contains 10% of this Providone iodine, equivalent to 1% iodine. It contains other inactive ingredients, which include purified water, citric acid, glycerin, sodium chloride, sodium phosphate, nanoxynine, etc. It is also a water-soluble base and it's not greasy or stick. More so, Betadine causes protein denaturation, precipitation of bacteria, resulting in death of microbes. I have mentioned this earlier in the mechanism of action, whereby I have said that the iodine that is released interacts with the cell membrane of microorganism, causing the death of the microbes. Therefore, it is very effective in disinfection and sterilization. More so, Betadine has an antiviral, antibacterial, and antifungal properties. I have said this when I said it is very effective against a wide range of bacteria, fungi, and virus. It is mostly for external use only. Betadine is poorly absorbed through intact skin but through denuded skin, meaning that it is easily absorbed in a skin that is ruptured or a naked skin. It has some side effects which includes irritation, rashes, itching, and redness. So when one is using Betadine solution, should avoid eye contact. So moving on to the route of administration, here I'll be talking about how it is administered to a patient. Firstly, prepare the Betadine solution. Mix 1 part of Betadine solution with 4 parts of saline solution or sterile water. Secondly, clean the area to be treated using a clean cloth or a gauze to clean the area to be treated. Thirdly, apply the Betadine solution and allow it to dry at least 10 minutes before any other treatment. So when applying the Betadine solution, use a cotton swab and make sure you apply a thin layer of Betadine solution. Fourthly, remove excess Betadine after 10 minutes. And lastly, monitor for adverse reaction. Some people may have allergic reaction when they use Betadine solution, so you should monitor those reactions like irritation, itching, and redness. Moving on to how it is used in radiology department and relevant examples. Betadine, it is an antiseptic used in radiology to help to reduce the risk of infection. It is commonly used to clean the skin prior to any radiologic procedures such as X-ray, CT scan, and MRI. It is used to clean the area around the needle insertion site before any injection or IV line replacement. More so, it is used to clean and disinfect ultrasound transducers and other medical equipment. An ultrasound transducer, this is a device that produces sound waves. So to avoid infection from one patient to another, it have to be disinfected using Betadine. Lastly, it helps to reduce the inflammation and pain associated with radiation exposure. So here I have an example of where it is used in the radiology department. So it is used during a local anesthetic procedure. Ultrasound needle biopsy, it is a clean procedure. So to minimize the risk of infection, we clean the skin with Betadine, we cover the area with sterile drops and employ a sterile transducer over it. We then administer the anesthetic under ultrasound guidance. With this, I'm done with my presentation. Thank you guys for listening. You are welcome to comment and give question. I'm here to give answers to every question. Thank you once again.